I will just dive right into it. So who are we? I founded Kinto with my best friend and business partner, Jeet Singh. I guess we're probably best known as the co-founders of our technology group, which we took public and was acquired by Oracle for $1 billion. So we just made the unicorn cutoff there. But we have a very deeply experienced team here with a really strong track record of success. We're funded by the National Institutes of Health, who grant us $2.4 million through the SBIR program, and also through Red Star Ventures, which is our founding incubator. I'm also a co-founder at Red Star. But probably our most important partner is the Alzheimer's Association, who is the co-developer with us on the service that we're launching, and our dementia care experts. So what do we do? What does Kinto do? We are a tech-enabled service coaching and supporting family caregivers of seniors with Alzheimer's disease. Why? Because dementia family caregivers are the key to a $1 trillion problem. So if we look at the cost of Alzheimer's in the United States, we spend $290 billion in direct care costs, plus $235 billion in value of unpaid family care, for a total of $525 billion, which is projected to grow to $1.7 trillion over the next 30 years. And just to put in perspective, $525 billion is more than the 2019 revenues of Google, Apple, and Facebook combined. So these are just ginormous numbers. And yet, billions of those costs are avoidable. 25% of dementia hospitalizations are preventable. And nobody wants their mom to go to the ER at 4 in the morning. Nursing homes cost nearly $100,000 a year, and most families state remaining at home as their #1 goal. And only 36% of dementia patients have care limiting advance directives, and yet the vast majority of seniors wish to die at home. So this is the most important slide in my deck. The whole principle of Kinto, the whole tenet is that avoiding preventable costs equals better care. And we can see the incredibly strong alignment of interests between the health systems and family caregivers. So as I said before, family caregivers are the key. They have 100% decision-making authority over all the interventions, new technologies, innovations, etc. And they have a highly vested interest in better care and lower costs. And yet they are stressed, overworked, underpaid, desperate for support and guidance. And that's where we come in. So how does Kinto work? We start with in-depth care coaching sessions with dementia care experts via video call. And we're working with the Alzheimer's Association on that. And then we work with the caregiver to organize all their essential care data like medications, allergies, health conditions, care goals, etc., inside our Kinto Caregiver app. That data then is viewed real time in the Care Coach UI, which allows our coaching team to answer questions in real time, find resources, and most importantly, suggest interventions that improve care and prevent problems. Ongoing communication after that occurs via messaging in the Kinto app. So we have very high scalability and the possibility down the road for intelligent automation. We're not doing that yet. So how will we make money? So we're going to charge a per member per month fee to various groups. It's a B2B2C model. Most importantly is Medicare and Medicaid, which are responsible for most of those the $300 billion that we're talking about in direct care costs. And we're targeting Medicare Advantage plans immediately. We also are offering it to large employers who want to offer caregiving support as an employee benefit. And finally, we're working with some pharma companies who seek direct engagement with high-needs patients. How much can we make? So back in the envelope calculation, a 5% reduction in dementia hospital admissions saves $3.3 billion a year. A 5% reduction in dementia institutional residency going into nursing homes and long-term care saves another $6.3 billion a year. So we have a total addressable market of almost $2 billion from just these two interventions alone, if you assume that we can capture 20% of the savings, so for a 5-to-1 ROI. These are the upcoming pilots. We got slowed down a little bit by COVID, but we're still expecting to do these in 2020. We're doing a co-branded offering with the Alzheimer's Association for a large employer benefits trial. We're working on a clinical settings trial with McLean Hospital, one of the most prominent geriatric psychiatry care centers in the world. And we're working on a pilot with the National Home Care Network and working with a number of different Medicare Advantage plans. Last, I'll just speak a little bit about COVID and what the effect of the pandemic is. As you probably know, 42% of the U.S. COVID-19 deaths so far occurred in nursing homes. In Massachusetts, it was 60%. So there's been a massive shift, or there is a massive shift towards home care enabled by remote and visiting services, because the concept of a virtual nursing home. That's resulting in a huge increase in the burden on family caregivers to manage all these providers, the services, and innovations and technologies that are being introduced to address this. So we think that the need for coaching and counseling support is greater than ever.